My name is John Corky. I am a founder of a digital health startup in Charlotte, North Carolina, addressing digital biomarkers for Alzheimer's and dementia.
Thank you so much, John. And I think everyone is in the same boat with our new Zoom life. Wakaka, would you like to do a little introduction?
Okay, good morning or good evening. My name is Wakako Tsuchida. I'm working for AMED, the Japan Agency for Medical Research and Development. AMED is one of the member of the sponsors for this competition. So I'm sorry, it's very late night. It's 9:30 in Japan, so I'm sorry I don't turn on my video, but yeah, thank you.
Thank you so much. Lai, would you like to share?
Yeah, my name is Lai Peng. I'm dialing in from Singapore, just like Wakako-san. It's late here. I'm actually having dinner at the same time. So you don't want to see me munching on my food while talking, listening in to you. I'm actually in a startup working on diabetic foot ulcers. So basically, we're having a smart insole that can be the proxy for the foot pressure, because obviously a diabetic person has neuropathy, so they cannot feel the pain like you and I. So we're kind of like doing something that can help the podiatrists to be better clinicians for the patients. And I'm interested in the biomarkers that you're talking about, because there's a relationship between diabetes and early onset of dementia.
Wow, that's really great. Thank you for sharing. While we are still waiting for our expert, maybe we can facilitate our own conversation. And Lai, since you mentioned an interest in the biomarkers, John, would you like to help bring about that conversation?
Sure, I can start. So we are essentially using the Apple Watch. Apple announced about a year ago that they're working with Biogen to aggregate data from cell phones, wearables, to understand the longitudinal progression of AD, Alzheimer's, and dementias, using different exercise, sleep patterns. So we are doing the same thing specifically with the Apple Watch, assessing how people sleep, basically their activities of daily life. But I think the difference where we kind of is our speaker here? I'll let him get started. Sorry.
No, go ahead. Keep going. Give me just another minute to organize the.
Sure. Okay.
Finding my way through the platform was harder than I anticipated.
Yeah. So Apple's
Please go ahead.
Roughly, I think they said 10,000 people that are at risk of having dementias. So we are currently working with a bunch of ADRCs around the country with people who are known to have dementias and looking at their family members. And so using a Apple Watch, passively collecting data, unobtrusively collecting their data to understand their behaviors, and can we identify those risk factors that can help us prevent the disease in the future or slow the progression of the disease for people who actually, have been diagnosed with different dementias.
Okay, thank you.
So the topic I'm going to be focusing on is global digital health. Now I have the presentation up. Let's see if I can get it shared into the Zoom screen. Great, thank you very much. All right, so hi everyone, my name is Dykki. I'm the Chief Digital Officer at PATH, and we are a global NGO that's focused on applications of technology and innovations to addressing challenges of global health equity around the world. PATH has been around for over 40 years. A lot of our efforts focused on building appropriate devices and tools for applications in low and middle income countries, particularly last mile of health. A lot of our innovations have been around the area around labels to measure temperature sensitivity for vaccines, for helping to support cold chain, the Uniject single dose injectable blister packs of little pre-filled injectors with needles to help support countries to be able to deliver vaccines and other medications quickly and effectively. Wide variety of other technologies that have been used. We also have done quite a bit of work at supporting development of vaccines, including the RTSS vaccine for malaria, really supporting an effort to focus on frequently neglected tropical diseases and really helping to focus the world's efforts and resources at innovations and technologies that can support that. As the Chief Digital Officer, I've been leading PATH's work since I came about 6 years ago in global digital health. And I wanted to take just a minute to give you an overview of the global digital health space. Not seeing everyone, so I don't know how many of you are familiar with the field of global digital health, supporting countries to help bring their health systems into the digital age as an effort to expand, as we'll see a little bit later, access, quality, and affordability of health services, again, for populations as much as possible. So it was really interesting to be invited to talk about this in relation to healthy longevity. And so, of course, I've been tracking for a very long time different measures of longevity, the dailies, if you will, QALYs. And in preparing for this presentation, I came across the HALE, that healthy life expectancy measure, and really began to dig into the HALE and examine how it's been captured across different countries. And one of the things we did is we plotted it, the HALEs against GDP per capita, really to highlight something I think is very evident to those of you who work more directly in healthy longevity, which is where you see less GDP per capita, the lower and middle income countries, according to the OECD, you also have a lot lower life expectancy. So just taking particular look at the average life expectancy by WHO region, according to the HALE, you can see here that Africa in particular is substantially behind other more developed regions. Okay, here's again another plot of that, just again showing that clustering and distribution by WHO region. And a lot of what the world's been doing to really address some of these challenges, it's a really, I think the HALE, the daily, however you choose to measure the relative longevity or the relative length to quality of life, in these countries, there's a big, one of the biggest challenges is the ready access, quality, and affordability of healthcare. And those three dimensions are encapsulated in SDG, the Sustainable Development Goal 3, the effort to try to achieve universal health coverage for all the world's population by 2030, a very lofty goal, and one that many organizations, governments, and efforts are going towards trying to address these substantial gaps in healthcare and coverage and help to expand and make those benefits of a high quality, longer life available to all. And so here we've taken the traditional cube of universal health coverage, those axes of x-axis down there with the population coverage, affordability, which is our y-axis with the cost coverage, and the quality of those services, which is on the z-axis. And so that's the typical cube as to how we think about the relative coverage of quality health services to support countries. And so what this slide represents some of the ways that digital and data can be brought to bear on some of these dimensions in a more transformative way to really help expand the reach of very resource-constrained health. Okay, so really, we've wanted to chart just a little bit of a history of what the plan's been so far. Again, it's a very nascent field where we're looking at digital transformation of health systems. And really, early in the stages, there was more of what we called the e-health phase. And that was really kind of a digitization. A lot of emphasis was focused on taking purely paper-based health systems, files, folders, forms, all of that, and beginning to move them into more digital applications. A lot of the early efforts were focused on taking existing records or existing needs for information, such as health service indicators, and moving them from facilities to the districts up to the national level, where many of the decisions were focused during the early part of during the last decade. Around 2007, of course, the iPhone came out. Shortly thereafter, the Android phone, and we saw a lot more energy and enthusiasm for this democratization, right? Many of the donors and partners who were having trouble necessarily understanding the technical details of the eHealth period really forged the mHealth period. How can we get apps into health workers' hands, and how can we support them to better manage, support, and extend their reach for health services? Around 2014, we really began to see the challenge of a highly fragmented approach that came along with all of these donors and partners and implementers who are really interested in these different apps and supporting different aspects of health services. And you often had a donor who would invest in a partner, put an app for HIV here, or an app for maternal health there, or an app for child health, malaria, all the different vertically funded health investments that are made to support countries. And often this could result, if you extend out the inevitable conclusion, in a health worker perhaps having 3 phones and 5 apps, all of which had to have duplicate data, and none of which talk to each other. And so we found that the digital investments that were being made during this early periods of fragmentation were increasing the burden of care rather than decreasing the burden of care. And nothing captured this in sharper relief than the Ebola crisis in West Africa around 2014, where we had any number of partners and app solutions, none of which were meeting the need of countries in crisis in West Africa. And so a new emphasis began on how do we better align and coordinate? How do we focus on co-investment? How do we support country capacities to own and lead a larger vision for transformation, including national digital health strategies, costed investment roadmaps, better governance structures, enterprise architectures for the health system? How can these different apps come together and converge into a truly country-led vision for their digital transformation? So we've seen a lot more investment over the last 6 years or so, 6 or 7 years, in standards and interoperability. We've all aligned around stronger principles in the field and partnerships, again, deeply prioritizing country ownership and leadership of transformation rather than a more donor and partner driven fragmented investment model. Okay, now 2020, we all recognize the emergence of COVID, which suddenly cast a lot of the lessons that were beginning addressed for Ebola in West Africa into being a major challenge across the entire world. And it became increasingly clear that we can't be treating this as tech solutions at all. In fact, many aspects of digital transformation, whether it's interoperability or really just imagining what health needs to look like in a digital age in any country, is not a technical problem. It's actually a socio-political problem, which I think we all see playing out every day in the news and everywhere else you may get your information, that it's a socio-political problem disguised as a technical problem. And the more that we can lift up, engage more political levels of conversation, the more we can identify how we can address the challenges of data sharing, for example. How can we ensure greater privacy and security? How can we help ensure that individuals are protected and in control of their data and have the authority and autonomy to be leading their own health, even within these country-led health systems? And so for our discussion, what I thought I might bring us to is a framework that we use. Is a pretty common framework in the global digital health space. This comes from a document or a whole toolkit, really, that was published by WHO and the International Telecommunications Union back around 2012 or so. And they really articulated these 7 e-health building blocks. By the way, e-health and mHealth, after we moved into that coordination phase, we eventually were able to bring those 2 worlds together into this new world of digital health. And so really this framework came from that e-health period, but still, I think, lifts us intentionally out of that tech. You really see the tech focused in that central stack: infrastructure, on which you have standards and interoperability, on which you have services and applications that need to work together. But of course, none of that can exist well without strategy and investment, the enabling policy environment, and most critically for most countries, the gap in workforce capacity, whether it's digital literacy of health workers or the existing IT data analytics capabilities at the country level to really support these efforts. And then all of this requires a strong leadership and governance support. And that's certainly been the area of greatest emphasis and focus in our work at PATH with countries, is really working at the highest levels to support countries to really take that ownership and leadership of their transformation. But I felt like this would be a good starting place for our conversation as we reflect on the geopolitics, the dynamics of the differing relations between countries and regions, and the applications of digital health to healthy longevity. And so with that, I will stop my conversation and open up the floor for any questions, clarification, any reflections on what we've been talking about. Would anybody like to start?
Yeah, hey, good morning, Dykki. Thank you for presenting that. I think, you touched on the, many different apps for many different purposes. And I think one of the challenges that I see, I'm a founder of a company building an app specifically for dementia. But I think, one of the challenges you have is getting the data to understand population health, broadly speaking, to cover, the entire globe, is you have socioeconomic challenges if you're using wearables. We're always chasing the tail, like not everybody can afford the best wearable device or a wearable device at all. Then you have, if you have a company who is trying to do the science, it's expensive to collect the data, to develop the application, to collect the data, to process that, to build the algorithms that actually show, this is how it leads to that. So it is still challenging. Is it going to be small groups and you have interoperability challenges, or is that something that we're going to leave to the bigger companies like Apple and Google and, others? So, what are your thoughts on democratizing the availability of, doing health science or digital health science across the world? Any thoughts on that?
Yes, I love it. I love it. Boy, you touched on so many aspects. I don't know how you may want to keep circling us back on some of these, but I'm going to focus right where you left us at, which is, the way I think about it is, how do we better democratize the knowledge creation in health or the innovation in health? How do we better enable countries to equitably contribute to the kinds of technologies and the knowledge that we need, or the research and development that we need to really advance health equity? And there's one particular organization I'm going to point you to. It's called IDAR. I'm talking to you today from Geneva, Switzerland. IDAR is based here in Geneva with the Geneva Graduate Institute. And I think it's the Graduate Institute for Global Health. IDAR is IDAIR. It's the International Digital Health and AI Research Collaborative. And their core mission is to partner around the world to help increase equity in the knowledge making around health. So I think that gets a little bit to what you're talking about, is to how do we really support not just the capacities to use digital health, but to really innovate within digital health. Related to that work, so check out IDAR, see what they're getting into. They're here. I'm having the opportunity to meet with their director fairly regularly right now, and beginning to understand how do we connect these research communities, these knowledge-making communities, with the implementation communities of the different organizations and investors who are working to support the local capabilities. And in a parallel effort, we've really been working with the private sector, some of those big guns you're talking about, to think about how can those private sector entities come together in new ways to effectively invest for social impact, but even just as importantly, for economic development and maturation of the market in these countries that will enable them to engage more effectively. And a big part of doing that is thinking about, okay, how do we identify and create the local developers, the local innovators? How do we support them to be able to really develop these innovations and technologies that can take their countries forward and really address the challenges that they have to live with every day. And one of the ways that we're really looking at that, and PATH's global flagship initiative to tackle some of these challenges is called Digital Square. I encourage you to check out digitalsquare.org if you have a chance. I'll try to throw some links in the chat as we go. And Digital Square has put a lot of focus since that Ebola outbreak in West Africa on that alignment and coordination. But one of the big areas that Digital Square is focused is on support for the digital global goods, the open source technologies that have been being developed since that e-health period of the early part of this millennium. And how do we really support countries? There's already been a lot of investment support to support countries to take up these technologies. Really, these global goods are used all over the world. Many, many countries use them. But there hasn't been that strong an investment into the core technology itself, the support for those open source technologies. And so Digital Square has been working to align, I think we're up to about 15 different investors now, to better invest into those global goods. And connecting it back to that local economic development, a lot of emphasis right now is on how can these open source products that countries are using be better adopted, innovated, and contributed to at the local level so that local innovators and entrepreneurs can take these technologies instead of having to start from scratch. They can start from a foundational technologies that are already compliant with standards, that are already incorporate many, many hours of development and thought, but then make it their own using the power of the open source approach and the opportunity for local ownership and development. How can a global good transform into a local good and become something that's fully owned, promoted, and supported by that company and used as an tool to support their entrepreneurial development? So those are just a few thoughts in response to your question. I'll try to keep my answers a little less long-winded, John.
Thank you, sir.
All right. Radhika, I see your note in the chat. Did you lose me again after I disappeared?
No, once you got back, it was perfectly fine.
Great, great. Yeah, I don't know what kind of blip we hit, but I think we're
Yeah,
still
if nobody else has another question, I think the other challenge that we have is, it is so expensive for a company to develop a product and then start collecting this data. And at least here in the United States, we're funded by the National Institutes of Health, National Institutes of Aging. There's this effort to share data across, globally, or to improve research, but that's challenging. Like you invested a lot of time and money to get this data, and now you're almost expected to share it with everybody. So there's a hesitancy to either share it or get into the space of building the technology and letting the big guys like Apple and Google, Verily, et cetera, to do that. So I think the model that we're approaching is building a platform where we are collecting data on a unique set, individuals at risk of dementia, but offering that data to researchers so they can advance research rather quickly instead of having to get their own grants and collecting the data in exchange for they get to research, they get to use it to publish and build algorithms, but we share the IP. So yeah, we're interested in trying to find other companies and researchers around the world that can use that data to accelerate health research.
fantastic. I'm really interested in this dementia. I'm not sure if that properly falls into the domain of digital support for mental health, but there's been a real interest recently in investments for digital innovations to support mental health in countries. That's really accelerated under COVID. Wellcome, I think, has made it a major investment priority, is these mental health. And I probably got some connections, John. I'm going to put my email into the chat. If you want to follow up offline, I can make some of those connections. But I'm on a commission, a Lancet Financial Times commission, Governing Health Futures 2030. And a woman who's really been the big champion for digital mental health is in these countries is one of the commissioners. I'd be very happy to make that connection. And it seems to me there's some very natural connections between what you're talking about and what some of those efforts are.
Yeah, I appreciate it. And I think it does touch into, when you talk about mental health, well, we have a certain population with the disease, but then you have millions more who are their caregivers, who are dealing with their own struggles of having to leave their job and having to care for somebody. And, it's just, that is so stressful. the other part that we're doing is monitoring those individuals to see how being a caregiver actually, is, how it affects their health. If you're having to constantly watch somebody. So yeah, related to mental health, absolutely.
No, I think that's fantastic that you're thinking about that larger provider ecosystem and how they can be supported. And quite a bit of work, since a lot of this is, mental health is arguably in the same realm as some of the other more biological, I suppose, non-communicable diseases. So a lot of the same kind of support challenges and infrastructures for NCDs would seem also to apply to some of these mental health challenges when you think of how can the community, the family, and those caregivers continue that support. I'm going to put in a couple of other links that are related to that. Here's Digital Square that I mentioned, which is around the global goods. And so I'm not going to bother with the links so much as the names because they're easily Googled. ONA's Open Smart Registry Platform, Open SRP, Damagi ComCare, Medics, Community Health Toolkit. All of these are open platforms that were specifically designed and intended to support providers. Mostly it's focused on the community health worker, that informal health workforce that's used to try and extend that front line of care, but they're easily and quickly adaptable to support more, family or community-based caregivers. But these are just a few tools worth looking at. Again, open source, global goods that can be quickly adapted and scaled to help support some of the types of services that you're talking about, John. I promised my email.
Hi, I'm coming in late to the conversation. I'm Shantae.
Shantae.
John, I also would recommend you look at the Department of Veteran Affairs. We have the largest number of health professionals and mental health professionals in the world. And we also do a lot of innovation. We have several innovation. We have an entire division that does develop mobile apps and are always looking for innovators for innovation for technology, mobile technology. So I would definitely take a look at, it would be vaapps.gov and see what you see there. So that would just be a suggestion from which
I appreciate it. I'm actually a veteran and I'm familiar with that group. So yeah, I know Ann Lord Bailey and some others. And Shanti, your name rings a bell. Where are you located at?
Philadelphia.
Okay. Yeah, I've seen your name somehow.
You
But
probably, yeah, I also am the clinical nurse advisor for pressure injury prevention and management for the VA. So you might have seen me somewhere related to skin or wounds. So I came into this session because I am actually working on my PhD in the use of mobile technology to pretty much assess nurses' perception of mobile technology and the use to prevent pressure injuries, bed sores. And I've done all this research and looked at all this information. But one of the things I find that's the gap in all this, in all the innovation and all the apps and so forth is the assessment of the apps, to ensure that what we're building is actually having the impact that we hope the apps to have an impact. And any suggestions or any thoughts of ways or of how we can address this more in a systemized approach, because I see that there's all this technologies. We talk about e-health and all these different platforms, but on the back end, the end user, their use of the technology, and is the technology ever really evaluated to ensure that it is doing what the developer hoped it would do for its end user, for the person on the back, on the person that's using the app, especially when it comes to, of course, there's a difference between the clinician, the nurse, the patient, the resident, or the caregiver. How have you seen ways that that we're looking at the evaluation of that app instead of going, you go into the app and you go into the you get the comments, and then someone from the app makes the comments, responds to the comments. How are we looking at it in regards to research or any suggestions that you could think of? I know that was a lot.
No, it's perfect, and I'm trying to pull up some work that was done. Shante, before you got here, I was chatting about the kind of path, the history in global digital health, how we moved through an e-health period, towards the beginning of this millennium, and since the advent of smartphones and other tools, we went through an m-health period that has, in the last 6 or 7 years, really converged into a collective digital health and digital transformation period. It's been a very short history in terms of global, support for transformation of health systems, but it's moved very quickly. And during the m-health period, there was a group called MTurg, which was the WHO m-health Technical and Evidence Review Group. And I'm going to put in another couple of links here. The MTurg created a site called mHealth Evidence, where they really saw the gap of, here's the MTurg at WHO. And let's see if I can pull up the mHealth Evidence site. And there's a lot of effort, and this was launched by John Hopkins, the JHU folks over there. And they spent a lot of time trying to support closing the gap in available evidence to really support appropriate adoption of these different tools and technologies. So that's Mobile Health News. I'm going to try to get a link here.
So you were saying that it's gone from e-health to in-health to, what's the new term now that you were saying?
Digital health.
Okay, yeah, digital. Okay, all right.
And it was kind of just constructed to try to reconcile the fact that these had shifted. I'm having trouble pulling up the actual site. So what happens, right, when you go through these continuous rapid evolutionary changes, you lose some of these links. I'm going to just try mhealthevidence.org, see what that pulls up. But it was something very close to that. And I see the mHealth Evidence reference site. I see a Mobile Health News article when I do a quick Google search, but I'll keep working on that.
So
and
you were
get that link in here, but I think there's a lot of resources around that mHealth Evidence, and a lot of discussion around how, or exactly the questions you're asking. And so certainly would love to support you to build on that.
Yeah, I would add, because this is what I do every day. For companies that really understand, who are passionate about the problem, they should be working with that end user to make that product, it should evolve every week, every day. They should be talking to the people and saying, is this working for you? Is it not? Like, how can we make it better? Some companies do that better than others. I don't want to sound like a broken record, but Apple does that very well. It's very expensive, but those companies that do that very, very well will succeed. Companies that don't, they're going to die. So it's having that culturally ingrained into the company that you have to engage with your users and other people who benefit, and finding out exactly that. We don't care about the features. What are the benefits for our users? That is what's going to drive success. So, and then Dykki, to your point about e-health, m-health, digital health, in 10 years, we're just going to call it health.
Yeah.
Bingo.
Yeah, exactly.
And then another resource for the entire group, if you're not tracking, is the Digital Medicine Society out of Boston. Jennifer Goldsack and others, brilliant group of people leading the charge up there. So, but yeah, just a couple of things to add.
Awesome.
I'm
really
sad.
I find that there's such a huge gap. And so so you want the workforce to use this technology, and then you want the end user to use the technology, but no one's really overseeing to ensure that the technology is doing what it's supposed to do. And then people get frustrated and move away from it. And then also how we educate our health professionals, our society relation to digital technology. I find that there's a gap in that also, because there's a lot now. COVID for us, for where I'm at the VA, we use a lot of telehealth. And COVID, we increased that use of telehealth significantly. And we're fortunate that we have such a huge platform. But even the word telehealth is a new word for a lot of patients and folks, because they were used to going into the office to see their doctor, and now they're getting thrown with this new type of digital health technology that they were really struggling with, especially if you don't have the Wi-Fi capabilities. And so that's the, that brings in that disparity, or that the impact to health equity related to the use of any of these technologies. And it kind of falls into the building blocks that you showed, that kind of threads in across into that, especially in the area of the infrastructure, because I feel like infrastructure has to be part of all those different areas, because none of that matters if there is no capability to use the technology, no system, no Wi-Fi technology in order to use. So.
Thank you, Shanta. Real quick, we only have a couple minutes left in the session, and Lai Peng had written in the chat, she'd like a little more discussion around the sharing of data, around taking a village. If we can share aggregate data that make each of our solutions so much richer and perhaps better patient outcomes for our users. I think that's very timely with all of the discussions of a new pandemic treaty, and the sharing of data globally for tackling and handling new pandemics is a really important issue that's begun to emerge. We've recently seen the launches of WHO's Berlin Hub for Pandemic and Epidemic Intelligence, the Global Pandemic Radar, also the International Pandemic Surveillance Network, and most recently Data.org's announcement of investment from Rockefeller and Wellcome to create their Epiverse data hub. So now I think we're going to have a little bit of fragmentation, proliferation of data sharing opportunities, all a little bit in advance of the establishment of a treaty that can really help us effectively address the data sharing challenges and issues. So I just thought I'd throw some of those out there as we wrap up this conversation. I'm going to throw my email back in here again. And please reach out. I know this has been really short, cover an awful lot of really fun topics. And so if any interest in discussing more, I'd be very happy to support.
Thank you so much.
Yes, thank you so much. Definitely would reach out to you.
Okay, I look forward to it. Thank you all for joining today.
Thank you, Dykki.
Thank you.
Yes, I will definitely reach out. Thank you.
Okay.
Thank you.
Thank you very much.